A new module called Consult Management has now been added. Now this allows for consultation notes to be previewed and then sent to the patient's GP. So this is most applicable for A&Es, accident and medical practices. To be able to use the Consult Management, it needs to be given in the staff setup. So setup, staff members, provider name, access tab, and here's Consult Management. So here's where you can tick if this provider will have access to Consult Management or not. The practice also needs to confirm they have a consult template, so a consult template document, attached to the location settings within the clinical tab. So this can be confirmed by going into the location setup. And coming into the clinical tab. So it's here that the consult template needs to be attached, and we can see that it is showing in there. A new merge symbol has been added to combine the patient's consultation notes for an appointment. So what this means is if the patient has more than one consultation for the same appointment, so if they saw the nurse and the doctor, and both the nurse and doctor entered notes, if we use this new merge field, then all of those notes will be displayed, so both the notes entered by the doctor and the notes entered by the nurse. So the field needs to be in Setup and Outbox Document. Click on the document that's attached in the location settings. Come to the Document tab, and we can see all of the merge fields that are currently in the document. I'll just place the cursor in here and click Insert. And now there's also a new filter option. So if we come to Consultation Notes Template, there it is, and we're going to select all consultations for the appointment. So any notes entered for that appointment will show in the document. So it says Insert here, okay, and that's just inserted it into the document here. For this to work, the patient does need to be in the appointment book or in the queue. So just open the appointment book, or click on the icon here. So the patient needs to be either in the appointment book or the queue, and they need to be arrived. So if I come down to Q1, so the patient needs to be sitting in here in the queue, otherwise it's not going to work. So that's the first thing we need to make sure has happened. As well as being arrived in the appointment book or the queue, the patient also needs to have their GP entered in the F3 screen. So I'll just open the F3 screen and come into the Account tab. So here is where a GP needs to be entered to be able to send it through the Consult Management. On the More tab, there's also the option to select Do Not Send Consult Notes, and this means that they will not be sent through Consult Management. However, this feature to Do Not Send Consult Notes will not affect the existing consultation unload utility. So if you select this option, when you go to Utilities, Miscellaneous, Consultation Note Unload, it will still include this patient. This option is only relevant to the Consult Management screen. So now that I've confirmed I have the staff access for Consult Management, the documents attached with the correct merge field, the patient has been arrived in the appointment book, and in the F3 screen they have a GP, and they don't have Do Not Select Notes ticked. So now I can go and do my consultation and then send the notes away. So I'll click on New Consultation and start typing in the notes for the doctor. So doctor's notes, and I'll now click on the new consultation icon and type in some notes for the nurse. I'll come to the More tab and I'll change this to a different provider. So even though the notes are entered by two completely different providers, we'll still be able to see both sets of notes entered. Okay, and I'll exit this. Now Module, Outbox, consult management, and I can't see anything in here. So firstly, I need to check the filter settings. So click on the filter. So it defaults to the day's date. I can select the look back range here, and we have the status. So if I only wanted to look at ones that have been sent or have been excluded, I can filter this here, and the registered status here. Now because this is mainly for A&Es, it won't have registered ticked, and that's why my patient isn't showing up. So I just included the registered in, and now I can see the patient notes in the consult management. I can preview them here, and I've selected them so it's showing in bold. So when I click send, it's going to send it to the patient's GP from the F3 screen. Now it's also going to print out what I've sent to the GP, and it's also going to print out a consult management summary, so any other notes that I've sent as well. All messages that have been sent will be lodged as an RSD in the messages lodged window, and also once they're sent, a record will be kept in the patient's outbox as well. So the advantages of using the consult management versus the consultation unload would be that in the consult management you get to review the notes prior to sending them, and also the fact that it's going to keep a record within the patient's outbox that you've actually sent the notes. So it will keep a record in here of the notes that have been sent out. And also it's quite handy that all notes entered for the one appointment, even if they're by different providers, are included into this outbox document.